Good evening, America! Welcome to Who Wants to Be an RN? Tonight we have, straight out of Lonsdale, Minnesota, our first contestant, Brittany Karsten. Please welcome to the stage. Hi, Brittany. How are you tonight?
Oh, good. How are you?
Great. Happy to have you here with us tonight. Tell me a little bit about yourself.
Well, I am a second semester nursing student and excited to be here.
Fantastic. Well, excited to win some big money.
I hope so.
All right, well, let's get started. Your first question will be tonight. Which of the following is a proper definition of congestive heart failure? Is it A, decreased cardiac output, B, death of a certain part of a myocardium due to ischemia, C, a chronic condition where the heart cannot pump enough blood to the tissues and meet oxygen demands, resulting in fatigue, dyspnea, pulmonary or peripheral edema, or D, a result of hypertension, valvular disease, or an MI?
Oh, I think that one's kind of easy. I'm going to go with C.
You're going with C, the chronic condition one, huh?
Mm-hmm.
Well, you would be correct. Way to go for your first one. All right, we're jumping right up to the next level. A proper definition of acute MI is excessive chest pain, anxiety, and elevated blood pressure. B, an acute condition caused by myocardial ischemia and myocardial death manifested by unrelieved chest pain, shortness of breath, cool clammy skin, and fear of death. That's kind of a scary one.
Yeah.
C, episodes of pain in the chest caused by physical exertion or stress. Or D, when the heart ceases to circulate blood and generate a pulse.
Well, I think I'm going to go with B.
You're going to go with B. You're not even going to think about it.
Well, I kind of did after the last two game else. They didn't really.
Okay. Well, I want you to think about it because someday you may be not my nurse, so you got to think about it.
Yep,
All right.
I thought about it.
B it is. It's your final answer?
Yep.
All right. Well, Brittany, you are correct. It is B. Another round for Brittany. It is an acute condition caused by myocardial ischemia. Wow, we're moving right along. Question number 3. While acute MI is the result of reduced oxygen to the heart, CHF, however, is the result of A, high accumulation of lipids in tissue and vessel walls, B, myocardial disease that affects either the contraction or filling of the heart, C, increasing amounts of fluid in the pericardial sac, and increasing pressure on the heart, or D, dysrhythmias.
Well, I'm kind of unsure on this one. I don't want to use my lifeline this early, but I'm going to have to use my lifeline.
There's quite a bit riding on the line.
Yeah.
Okay, who are you going to call?
Perpetual.
Perpetual. Okay, let's give Perpetual a call.
Okay.
Hi, how can I help you?
Hi, Perpetual. This is Brittany. I'm on Who Wants to Be an RN, and I have a question for you. While acute MI is the result of reduced oxygen to the heart, CHF is the result of A, high accumulation of lipids in tissue and vessel walls, B, myocardial disease that affects either the contraction or filling of the heart, C, increasing amounts of fluid in the pericardial sac, increasing pressure on the heart, or D, dysrhythmias.
Your correct answer is B, myocardial disease that affects either the contraction of the filling of the heart.
And how sure are you on that one?
I'm 100% positive.
100% sure, she says.
Yep, I'm going to go with B.
No question about it.
No.
B, so you're saying myocardial disease that affects either the contraction or filling of the heart.
Yep.
Final answer.
Final answer.
Well, Perpetual is correct. It is myocardial disease. Okay, we're moving right along to your next question. How far can we go tonight? Number 4, what type of medication is used to treat both acute MI and CHF? Is it A, calcium channel blocker? Is it B, antiemetics? C, antipsychotics? Or D, beta blockers?
Well, I kind of wish I went to use my lifeline now.
Yeah, that's kind of a tough call.
It is. I'm kind of torn between the calcium channel blockers and the beta blockers. And I just don't know. I'm not sure.
You're
I'm going to
not
have to
sure.
drop out.
You're going to drop, you're going to just take the money and run and
Yep.
Use what you can. Okay. Well, just for fun, what would you have guessed?
Beta blockers.
Well, Brittany, I hate to tell you, that would have been right. So, well, anyway,
Oh,
thank
well.
you for playing. It's
Yes,
great
thank
having you
you.
tonight on Who Wants to Be an RN. Thank you. Welcome back, America, to our second contestant tonight. We just had Brittany with us tonight, and unfortunately, she did not make it very far, and let's hope that she does eventually make her RN. But now, straight out of Faribault, Minnesota, or Mankato, Minnesota, I believe, it's Ambry Strait. Welcome to the show. Tell me a little bit about yourself.
I'm a second semester nursing student, and I'm hoping this is going to pay for my rest of my schooling.
Sounds great. Well, let's just jump right in.
All right.
Okay, your first question for the night is, all of the following are symptoms of CHF except A, orthopnea, B, paroxysmal nocturnal dyspnea, C, chest pain, or D, dependent edema.
This one's pretty easy. I'm going to go chest pain.
Pretty easy. Well, it's pretty easy for you, but yes, it is. You must be right. It's chest pain, so very nice. Okay, well, moving right along. Other than chest pain, what other major symptoms correlated with myocardial infarction? A, numbness or tingling in the feet. B, restlessness and anxiety. C, blurred vision. Or D, elevated temperature.
I'm going to go with B, restlessness and anxiety.
Final answer.
Final answer.
You're sure? Think hard.
Yes.
Okay, I have to test it, but yes, you are correct. It is restlessness and anxiety. Very nice. I can't make it too easy on you now.
I know.
Okay, this is for all the money. Your next question, which of the following is a nursing diagnosis for acute MI? Is it A, activity intolerance and fatigue related to decreased cardiac output? B, excess fluid volume? C, anxiety related to breathlessness from inadequate oxygenation? Or D, ineffective cardiac tissue perfusion related to reduced coronary blood flow?
This one is a little bit more tricky, but I think I'm going to go with D, ineffective cardiac tissue perfusion related to reduced coronary blood flow. That one best fits it.
I think that fits it best.
Yep.
Okay, your final answer.
Final answer.
Oh, Ambry. You are correct. It is ineffective cardiac tissue. All right. We are just cruising right along tonight. So let's jump into the next one. You are discussing goals with a patient who has CHF and dependent edema. What is a realistic goal for this patient? Is it A, patient will exhibit reduced edema in lower extremities after 2 weeks of diuretic use? Is it B, patient will tolerate increasing levels of activity without experiencing chest pain? C, patient's baseline rhythm is maintained between 60 and 100 beats per minute? Or D, patient has no complaints of orthopnea, paroxysmal nocturnal dyspnea, or shortness of breath? Whew. Try saying all that.
Well, I think a realistic goal for a patient would be A.
Patient to exhibit reduced edema in the lower extremities?
Yes.
Final answer.
Final answer.
You're correct. It is A. Wow, we're going to fly right through. You're going to break the bank tonight for your RN license. All right, moving along. Which medication would you give your patient who is suffering from CHF and pulmonary edema that has breathing anxiety? A, nitroglycerin. B, metoprolol. C, morphine sulfate. Or D, furosemide or laces.
I think I'm going to have to phone a friend on this one.
Phone a friend. All right, your lifeline right away. And who are we calling tonight?
Molly.
Molly. Okay, let's give Molly a call.
Hi, what's your question, please?
Hi, Molly. I'm on Who Wants to Be an RN, and I have a question I need your help with. I have, which medication would you give your patient who is suffering from CHF and pulmonary edema that has breathing anxiety? A, nitroglycerin. B, metoprolol. C, morphine sulfate. D, furosemide, Lasix. I'm kind of torn between the nitroglycerin and the morphine sulfate.
The correct answer is C, morphine sulfate.
How sure are you?
100% sure.
I'm going to go with C, morphine sulfate.
Morphine. Well, Molly sure sounds confident. We're going to go with morphine then tonight. Okay, final answer, morphine.
Final answer.
Our lifelines have been good tonight. Morphine is correct. Very good. Excellent. Only a couple more questions to go before you make your RN. Okay. With proper and timely treatment, a patient with acute MI is expected to exhibit which appropriate responses? A, state decrease in chest pain. B, is able to rest, displays reduced tension, and sleeps comfortably. C, no longer requires increase in analgesia or nitroglycerin. Or D, all of the above.
I really hate all the above questions.
Don't you,
It
though?
makes me start thinking and second guessing myself, but I think this one is going to be all the above. D.
Ooh, D. Okay, we're going for the whole lock, stock, and barrel. Okay, final answer.
Final answer.
D is correct. Very good. One more question before your associate RN. Are you nervous?
I am.
You should be. This is the toughie. All right, we're moving on to the last big question. When evaluating a patient with CHF, which finding shows that the patient is making sound decisions regarding his or her care and treatment? A, patient can demonstrate his or her ability to influence the outcome of treatment of care. Patient exhibits heart and respiratory rates within normal limits. C, patient verbalizes fear or concerns. Or D, patient knows how to contact their healthcare provider.
Oh,
This is for all the marbles,
no,
Hamry.
I wish I had a lifeline. But it is the patient making the sound decision regarding the treatment. So I think I'm going to go with A. Patient can demonstrate his or her ability to influence the outcome of treatment or care.
A,
Yes.
final answer.
Final answer.
Well, Amber, you are correct. It is A. You have reached your associate RN tonight. Congratulations.
Thank you.
Now I've got a proposition for you tonight, Amber. You can throw that all the way or walk away with your associate RN, or you can risk it all and go straight to your BSN with one more question. What do you say?
Well, I do want my BSN, so I think I'm going to risk it all.
You're going to risk it all and go for all the marbles.
Yes.
All right, America, here we go. She wants to go for it all. All right, your last question. To become the BSN that you desire, what ethnic group is at higher risk of obtaining CHF? Is it A, those of Asian descent, B, Native Americans, C, those of Hispanic descent, or D, African American males?
Do I get an extra lifeline?
Not for all this, all the marbles. It's just gotta be you now.
All right. I think I'm going to go with D, African American males.
African American. Okay. Lock it in your final answer.
Yes.
You are correct. You have just made your BSN. Congratulations. Good night, America.